Laser treatments are commonly used in a wide variety of skin conditions, but like any medical procedure, it's important to ensure that the treatment is carried out safely. Recently, a tragic incident occurred in Tianjin, China, where a 27-year-old woman died after undergoing a series of laser treatments to remove freckles. This incident has raised questions about the potential risks associated with laser treatments. So today, I'll explore some of the possible causes of untimely death and the steps to mitigate this risk. The article reports that the patient had pre-existing Neurofibromatosis Type 1, aka NF1, and had suffered a cardiac arrest post-treatment but had ultimately passed away due to brain herniation. NF1 is known to be associated with brain tumours and obstructive hydrocephalus, which can in turn lead to raised intracranial pressure, or ICP for short. Raised ICP can be life-threatening if it leads to brain herniation. When herniation occurs, vital areas in the brainstem are compressed, leading to respiratory and cardiovascular dysfunction. While laser treatments are generally safe, it's important to recognize that any procedure involving sedation carries with it considerable risks, especially for patients with pre-existing medical conditions. Several theories could explain how the laser procedures may have led to the raised ICP that eventually resulted in her death. Let's break them down. 1. Sedation-related complications. The report mentioned that the patient had to stop several times during the procedure due to unbearable pain. While numbing cream would usually suffice for laser treatments, patients with low pain tolerances may choose to opt for oral analgesia or sedation to better manage their pain. All sedatives carry a risk of hypoxia and cardiovascular collapse, which could in turn result in cerebral edema or brain swelling and ultimately raise ICP. The choice of sedative is also crucial. Ketamine specifically is known to potentially raise ICP. Given that NF1 already puts at risk of raised ICP, if ketamine was administered during sedation, it could have caused a dangerous increase in pressure within her skull. 2. Local anesthetic systemic toxicity, aka LAST. Systemic toxicity from an overdose of local anesthesia is another rare possibility. Local anesthetics, like lidocaine, may be used to numb the treatment area. If too much local anesthetic is used, systemic toxicity can arise, which can lead to seizures and respiratory dysfunction. To cause systemic toxicity, however, an extremely high dose of around 5 mg per kg would be needed. Although very unlikely, this remains a rare possibility. 3. Anaphylaxis. Anaphylaxis is a severe allergic reaction that can be life-threatening. Anaphylaxis may be triggered by any allergen, but usually occurs as a result of systemic rather than topical exposure. Anaphylaxis could result from widespread administration of topical anesthetics, although from the article it seems that she had undergone the same procedure multiple times before. As such, this theory is less likely. 4. Incidental seizure. Lastly, it may be possible that the patient suffered an incidental seizure. People with NF1 are predisposed to seizures, and it is possible that the patient had incidental seizure during the procedure. This could have led to hypoxia, cerebral edema, and raised ICP. Although these scenarios are rare, the consequences can be severe. This is why it is absolutely essential to take all the necessary precautions before, during, and after treatments involving sedation. While these theories are speculative, the key takeaway is that all treatments, as well as any accompanying analgesia or sedation, must always be tailored to the specific patient while taking into account their existing medical conditions. At SL Aesthetic Clinic, we avoid sedation as much as possible because of its associated risks. Instead, we have several pain management protocols in place to minimize discomfort. These include 1. Applying a topical numbing cream to the treatment area. 2. Icing or cooling the treatment area. 3. Various methods of distraction such as vibration or tapping. In general, laser treatments are very tolerable, and it's extremely rare that a patient will require sedation. Of course, everyone is different, which is why every consultation at SL Aesthetic Clinic starts with a detailed discussion to check for any existing medical conditions, medications, and allergies. This helps us understand your individual needs and ensure that the procedure is safe for you. Our doctors maintain constant communication with you throughout the procedure. If you start to feel uncomfortable, we can always adjust the settings to make the treatment more tolerable. For certain treatments, we may opt to use local anesthesia in small, controlled amounts to numb the treatment site, ensuring that you're comfortable. Depending on your medical history, oral painkillers can also be an option to help with discomfort. At the end of the day, your safety and comfort are of utmost priority. Every step we take, from consultation to treatment and even post-treatment care, is aimed at minimizing risk and discomfort while ensuring that you achieve visible results. If you're considering a laser treatment or other aesthetic procedures, don't hesitate to reach out to us. Thank you for watching and see you next time.